Psychopathology, in my defined interpretation based on my worldview, is a study of mental illness brought on by genetics and or the individual's environment. Mental disorders are found in not only stem from nature but also nurture. Genetics play as much of a role on mental illness as much as the things individuals are exposed to and experience throughout their life. A lot of phobias and unconscious traumas can be traced back to an experience an individual went through and was not able to process the event fully, leaving them with abnormal behavior that sometimes show up as mental illness. Lessons learned based on your religion and worldview are a part of nurture. It is important to consider the effects of religious teachings and beliefs when it comes to defining an analysis of a disorder and a therapeutic approach. It can have both a negative and positive effect on approaches used to diagnose a client. A negative effect is when considering your Christian faith when diagnosing an individual. A counselor can be reluctant to pass judgment on a patient, which can cause harm or allow further examination. The harm can be caused by the delay in diagnosis, which inadvertently causes a delay in treatment. The positive aspect of the delayed diagnosis can allow for a thorough exam, but counselors should just use caution in their approach by checking their biases, which will help them eliminate the hesitance in accurately diagnosing the patient. When considering the biblical definition of an abnormality, it can be interpreted in many ways. Just as medical studies surrounding mental illness required evolution, so did the biblical approach. According to Poon McBrayer 2019, historically, Bible-based schools have been known to view children with a disability as a burden or sent them to monasteries in isolation. This approach has changed significantly with the Great Commission's global approach to bringing awareness to the need of inclusion of individuals who have abnormalities, according to Poon McBrayer 2019. As the Bible stated in John chapter 9, verses 2 through 7, and his disciples asked him, "Rabbi, who sinned, this man or his parents, that he was born blind?" Jesus answered, "It was not that this man sinned or his parents, but that the works of God Almighty be displayed in him. We must work the works of him who sent me while it is day. Night is coming when no one can work. As long as I am in the world, I am the light of the world." Having said these things, he spat on the ground and made mud with the saliva, then anointed the man's eyes with the mud. Although the Bible does not distinctly define abnormalities, there are multiple examples, as the one previously mentioned, that does not associate abnormalities as a curse or a condition requiring an individual to be casted away from society or treated disparagingly. Throughout the Bible, God has shown favor to individuals with abnormalities and consistently expressed that they are his children, just as an individual without an abnormality, and should be treated as such without judgment. Unlike the biblical definition, abnormalities from a secular view are distinctly defined as characteristics that are not considered to be standard characteristics based on social norms. These characteristics usually require some form of medical treatment through medicine or counseling. There is not much grace given to individuals with abnormalities these days, considering most of the facilities that was once able to house and treat these individuals are now closed, leaving them with untreated abnormalities that encourage behaviors that are leading them to prisons instead of the treatment facilities they could have been using had there been more available.